serratus is pretty easy for the front. You have to do serratus in 2 steps. You have to do serratus from the front so you can get all these lateral ones easier, and then in the prone position so you can get underneath the scapula, okay? Remember, is ribs 1 through 9. So all from the top rib all down to about here, all on this lateral side, okay? So real easy. This is very similar to the way you did the intercostals, the way we did the raking of the abdominal. Same principle here, except you're just doing it higher up. If you have a female client, they have to move the breast tissue out of the way, okay? Now with the intercostals, remember your fingers were in the grooves between the ribs. For serratus is not between the ribs, it's lying over top of the ribs, okay? So now instead of having your fingers between the ribs, you want them on the ribs, okay? So again, just, you know, palpate with your client right now. As you kind of get used to this, you want to poke and prod a real client, but just for now you can. But make sure you're not in between the ribs, you're on the flat surface of the ribs, okay? And I can just lift and break, lift and break, okay? So you can do that. Again, she's holding her breast tissue. I shouldn't have an issue. If the client's too well endowed, then you can't do it this way, but I will show you how, when they're prone, you can also get this, okay? So just a little bit of lifting and raking. Then I will show you how to work from the side when they're prone, okay? And I'll show you how to do that. So just some raking, but the finger placement is the most important when you're doing this technique, okay? On the surface of the ribs rather than in between. If you're in between, you're getting the intercostals. Now to get the surface, the anterior surface of the muscle, we're going to pop this up. This will also be a good way to get rhomboids as well, okay? So let me get, okay? So what you want to do, remember, serratus comes all the way over here to the medial border, on the anterior lip of the medial border, okay? So now, and the anterior lip is going to be facing into the rib cage, okay? So now I can get my fingers a little bit underneath that lip where I couldn't before. And I also can get under here a little bit, okay? So I can get under there as well, okay? And I'm gonna insert the rolled up towels right underneath the glenohumeral joint. See how that pops that up? Nice, very nice, okay? So now I can kind of work. Now, how far under the scapula you can get is going to depend on the client, okay? Okay, and look, the scapula is movable, so move it, push it, okay? Get that muscle to stretch, okay? Okay, serratus coming up here, passing anterior, along the anterior surface of the scapula and inserting along the medial border, okay? So to get underneath there, I've already inserted the rolled up towels underneath the glenohumeral joint. His scapula pops up nice, okay? So this is what I'm gonna do. Of course you wanna do a warm up, okay? Because you don't wanna be digging underneath there with cold muscles, okay? I'm doing my fast warm-up right here, okay? So now I can just kind of slide along till my fingers curve under, and I can get my fingertips. I want my finger pads, the pads of my fingers, to be up against the anterior surface, okay, as much as I can, okay? And just do a little friction all along that anterior lip of the medial border, okay, back and forth. Okay. And I can do the same thing from this side. Okay. Here's my lateral border right here. Okay, so get underneath there if you can. Okay. Lift it up even a little more. Okay, just a little back and forth friction. If I pull it towards me, then it'll come up off the rib cage a little bit, and I can really get underneath there. Okay, it's a movable bone, right? You're not doing anything that it wasn't meant to do. Okay, so don't be afraid. Don't try to, once you hit a point where it stops, don't try to overly stretch it, right? Just come to a point where you get resistance. You're not going to pull this off of the rib cage, I promise you. Right? I can get underneath both sides at the same time. Okay. I'm also, when I'm working here, I'm getting the insertions of rhomboids as well. So you can be working two muscles at the same time. Okay. Okay, again, stretch, push that rhomboid. Push that scapula.
No levator?
We're not at levator yet. Okay. Okay. All right. I'm going to let you guys do those.